right, Miss Amber, whenever you are ready.
Okay. Good morning, my name is Amber Hampton and I'm an AP research student here at Southwestern Randolph High School. For my project, I knew I wanted my topic within the scope of veterinary medicine. I've been involved in veterinary medicine my entire life. My mother's a veterinarian and I worked in a veterinary hospital for almost 4 years. I also knew with the topic in veterinary medicine, I would have access to ample resources to conduct my own research. So I discussed with my veterinary practice manager at the time topics to relieve current issues in veterinary medicine. She and I both agreed that many dogs were not on heartworm prevention and that sometimes veterinary staff does not do the best job at educating clients on the importance of heartworm prevention. So I posed the question, does educating the client about the severity of heartworm disease and necessity for heartworm prevention increase client adherence to the recommendations of veterinarians at Blue Flint Animal Hospital regarding heartworm prevention? Lots of research has been done about heartworms, heartworm disease, and heartworm prevention. Much research has also been conducted about client education in veterinary medicine, but little research has been done to connect the two. I chose to narrow the scope of my topic, particularly in the location, to Blue Flint Animal Hospital. Blue Flint is a privately owned, 4-doctor small animal hospital located in Asheboro, North Carolina. Absolutely no research has ever been conducted at Blue Flint regarding heartworms, heartworm disease, heartworm prevention, and/or client education. Selecting and narrowing my question to a specific animal hospital allowed me to identify a gap in previous research, conduct my own research, and find new results. Let me first educate you so you can have an understanding of heartworms and its disease and the importance of preventative medications. Heartworm disease is caused by a parasitic worm that depend on a vector, mosquitoes, to be transmitted. Microfilaria are baby heartworms that circulate the bloodstream of carriers infected by heartworms. Carriers include dogs, foxes, coyotes, and wolves, but for the sake of my research, dogs are the carriers that will be discussed. When a mosquito bites a carrier that has been infected with heartworms, the mosquito picks up microscopic juvenile heartworms. While in the mosquito, these juvenile heartworms mature into an infective stage. They are now considered infective larvae. The infective larvae are transmitted to dogs via mosquito bites. Once the dog is infected, it can take approximately 6 months for the larva to mature into sexually active adult heartworms. Adult heartworms resemble spaghetti noodles and can mature up to sizes of up to 12 inches. These mature parasitic worms reproduce inside the canine host and have a lifespan of 5 to 7 years inside the dog. The microfilaria, when first enter the bloodstream of the dog, are moved to the lungs. From the lungs, they are pushed into the pulmonary arteries, and the pulmonary arteries are where most heartworms will stay, but if the parasite burden becomes high enough, the worms will migrate to the right ventricle, the right atrium, and the vena cava. Heartworms cause severe damage and issues to dogs. They can cause heart and lung failure, damage to other organs, and overall decrease the dog's quality and longevity of life. Clinical symptoms of heartworms and heartworm disease start small and most times go unnoticed. Heartworm disease is divided into 4 different categories: mild, moderate, severe, and cable. Dogs considered to have mild heartworm disease may have an occasional cough or be asymptomatic. Moderate heartworm disease is when dogs exhibit a cough, exhaustion after exercise, and/or abnormal lung sounds. Clinical signs of severe heartworm disease include cough, abnormal lung and heart sounds, exercise intolerance, dyspnea, syncopal episodes, and large liver and a fluid-filled abdominal cavity. The cable stage of heartworm disease is when cable syndrome has developed inside the dog because of the large parasite burden. The cable syndrome is where a large number of heartworms create a blockage inside the dog's heart. Symptoms are typically quickly onset and consist of labored breathing, pale gums, and dark and bloody urine. Surgery is risky but required to remove the blockage and many times results in the loss of the patient. While the beginning stage of heartworm disease may seem small and most times go unnoticed, disease can rapidly advance to severe and life-threatening. Because of the severity of the disease, it is important that dogs are on heartworm prevention medications year-round. The following is a recent case study of a patient at Blue Flint Animal Hospital. A 10-year-old unaltered female Shih Tzu presented to Blue Flint Animal Hospital in November of 2020 and tested heartworm negative. The patient was not kept current on heartworm prevention, and the patient presented again for a wellness examination in December of 2022, where the patient tested positive for heartworms. In April of 2024, the patient presented back to the veterinary hospital for symptoms such as wheezing, coughing, and exercise intolerance. Upon examination by the veterinarian, abnormalities in heart and lung sounds were noticed. Radiographs of another heartworm test and proBNP blood work, which is a heart muscle enzyme test, were done. These diagnostic tests revealed that the patient was not heartworm negative, but in congestive heart failure as a result of the previous heartworms. The ventral dorsal view of the heart shows the enlarged heart in a globoid shape, so you can see that the heart is very circular, where a healthy heart should resemble more of an egg shape. In the lateral view, you can see the enlargement of the heart more because here this black line that goes through it is the trachea, and the trachea should be more central through the chest cavity, but the heart is so large that it's pushing up on the trachea. You can also see where there is right-sided damage in the heart. We talked about how a heart with a large parasite burden will have effects on the right ventricle and the right atrium. And here between this rib cage, I don't know if you can see from there, but this is an artery, and then the bronchi, which is an air valve, and then a vein. And so veins are associated with the right side of the heart. And here on this patient, you can see that this vein is dilated more than the artery, where in a healthy pet, your vein and your artery should be very similar in size. And that dilation is caused from trauma from the previous heartworms. So this is a chronic diagnosis for the patient that will require expensive medications to be given multiple times a day, frequent follow-up visits to the veterinarian, and even with adequate care, it will most likely progress to unmanageable. And that's why heartworm prevention medications are so important. While this patient was cared for and rid of heartworms, heartworms leave a lasting impact on the patient that create long-term issues. In the case of heartworms and heartworm prevention, an ounce of prevention is worth a pound of cure. Since the parasitic worms are found in all 50 states and other parts of the world, veterinarians, pharmaceutical companies, and scientists have worked to develop safe and effective preventative medications for heartworms in dogs. Heartworms cause severe disease that, if left untreated or even treated, can be detrimental to the dog's life. And treatment is risky, does not always prevent issues down the road, and is extremely costly. That is why heartworm preventative medications are so important. These preventative medications, if used correctly, are nearly 100% effective. There are multiple drugs and prevention medications effective for preventing heartworms, but because this research focused on the recommendations of heartworm preventions from veterinarians at Blue Flint Animal Hospital, moxidectin will be the focused prevention drug. Moxidectin is found in heartworm prevention medications produced by animal pharmaceutical company Zoetis, which partners with Blue Flint Animal Hospital. Moxidectin and all other FDA-approved heartworm prevention drugs are microlic lactones. Microlic lactones are found from organisms in the sole, and they are potent and proven to be a broad-spectrum anti-parasitic drug. Zoetis produces 3 different brands of heartworm prevention: Simparica Trio, ProHeart 6, and ProHeart 12. Simparica Trio is a chewable heartworm, flea, tick, and intestinal parasite prevention tablet that lasts for 30 days. ProHeart is an injectable heartworm and hookworm prevention, where ProHeart 6 has a duration of 6 months and ProHeart 12 has a duration of 12 months. Laboratory studies on both ProHeart and Simparica Trio exhibit a preventative efficacy of 100%. Even with products that are proven effective at preventing dogs from being infected by this deadly parasite, many dog owners neglect to keep their pet on preventative medications. This baffled me extremely, so I decided to conduct my own research to see if potentially clients were not being educated on the severity of heartworms, and could education urge them to protect their canine pets. When deciding upon my intended method of research, I was limited. My research would have been best suited for a survey where clients at Blue Flint Animal Hospital would be asked questions regarding the current status of their heartworm prevention and what influenced their decision in using heartworm prevention. But due to a recent Senate Bill 49, Parent Bill of Rights, introduced by North Carolina legislation, surveys were not an option for students to use as a research method. While this provided a setback in my process and hindered what information could be collected, I decided to do an analysis. This analysis would review how client education regarding the severity of heartworms and necessity for heartworm prevention could increase client adherence to the recommendations of veterinarians at Blue Flint Animal Hospital regarding heartworm prevention. This analysis would provide both quantitative and qualitative results that would assist in answering the research question. Before the research began, it underwent review by veterinary professional Dr. John Isaacs. The first step in the research process involved selecting participants. It was necessary to pick participants randomly in order to avoid bias, but participants had to meet a criteria. The criteria included clients of Blue Flint Animal Hospital with a canine pet over the age of 1 year scheduled for a wellness exam appointment type between the days of February 5th and 6th, 2024. Clients who met this criteria were asked a screening question once they arrived for their appointment. The question was asked, is your pet currently on heartworm prevention? Clients who responded no would make it to the client education portion of the analysis, and those that responded that their pet was already on prevention would have their response reported but be dismissed from further analysis. Note if their pet's current heartworm prevention medication was taken. Clients who responded no for the screening question were then taken into an exam room where the reason for their pet's visit would be reviewed, and they would be asked again to confirm that the pet was not currently on heartworm prevention. Once it was confirmed that the pet was not currently on heartworm prevention, the client was educated about the severity of heartworm disease and necessity for heartworm prevention. The transcript for educating the client was similar to that of the education portion of this analysis, but in an elaborately condensed format. Once the client was educated, they were asked if they would like for a heartworm test to be conducted on their pet. If those that agreed for the heartworm test, the test would be completed and then the veterinarian would help the owner decide what heartworm prevention medication for their pet. For those that declined the heartworm test, even after the education, would be educated again, but this time by the veterinarian. All those responses to the questions and comments were recorded on paper by myself. Before this analysis was conducted, it was hypothesized that the majority of canine pets would not currently be on heartworm prevention, but by educating the client about the severity of heartworms and necessity for heartworm prevention would result in the client following the heartworm prevention recommendations of veterinarians at Bluefield Animal Hospital. Between the days of February 5th and 6th, 2024, 11 participants were analyzed. The results of this analysis were inconsistent with the hypothesis. All 11 clients who met the qualifications to be a part of the analysis had their canine pet currently on heartworm prevention. This analysis provided the quantitative data that 100% of clients during the time period of the analysis had their canine pet currently on heartworm prevention. Record was also kept during the analysis of what prevention medication the owners were using. And this extra information showed that 63.7% of clients were already using the recommended product for their pet's heartworm prevention. And this made for speculation as to why so many clients were already compliant. Overall, the analysis research method concluded that all participants had their canine pets currently on heartworm prevention, and a majority were following the recommendations of Bluefield Animal Hospital veterinarians regarding heartworm preventatives. But these results provided no conclusion to the original question of research of this analysis. In order to understand why the results of the initial research question were inconclusive of the hypothesis, a second method of research was implemented. To uncover results that would answer the posed question, Dr. Carrie Hampton, practice owner and veterinarian at Bluefield Animal Hospital, was interviewed. The interview was a chosen method of research because in-depth questions could be asked to understand any past events that could have occurred at Bluefield Animal Hospital that would lead clients to already have their canine pet on heartworm prevention. Dr. Hampton was asked to discuss any previous client education conducted by Bluefield Animal Hospital staff. From Dr. Hampton's response, it was learned that shortly after ProHeart 6 was released by Zoetis in 2008, she was hired by Zoetis to speak to fellow veterinarians. Dr. Hampton was chosen because of the large quantity of ProHeart her clinic was already administering to patients. Because of this, she was educated in depth by the pharmaceutical company about heartworms, heartworm disease, and prevention. Dr. Hampton took this information and passed it to her staff, who assisted veterinarians in educating clients about heartworms and the prevalence of mosquitoes in the area that increased the necessity for keeping pets on heartworm prevention. The results from this interview showed the importance of client education. From the research conducted, it was concluded that client education is vital in increasing client adherence to the recommendations of veterinarians at Bluefield Animal Hospital regarding heartworm prevention. It was also understood that client education can lead to a long-time retention to the adherence. These conclusions and results and understanding from the research should be influential to other veterinarians and hospitals. Professionals in the industry should understand the impact educating clients has on increasing the amount of canines on heartworm prevention. They should take these conclusions and implement client education into their own veterinary hospitals, especially in hospitals located in areas of high risk for mosquitoes and heartworms. By more veterinary hospitals educating clients on the severity of heartworms and necessity for heartworm prevention, a number of canines' quality and longevity of life will increase. Not only can these conclusions be addressed for heartworms and heartworm prevention, but by understanding the value in client education, additional education for clients about other medical issues in veterinary medicine can be obtained, thus increasing awareness for the diseases and illnesses in order to diagnose, treat, and resolve them before they decrease or end the patient's life. And that concludes this presentation.
All right, whenever you're ready, Ms. Cutler.
Okay. How did your initial exploration of the scholarly conversation lead to your final research question?
So like I stated in the presentation, I discussed with our practice manager at the time issues believed to be, problems in veterinary medicine. And so I eventually had the project goal to increase the quality and longevity of canines' life. And so we found that with a lot of dogs not being on heartworm prevention, this is detrimental to the dog's life. We work with a rescue at Blue Flint, and we see a lot of dogs that are strays that haven't been kept on heartworm prevention all their life, and so they come in and we do their routine heartworm test and they are heartworm positive. And while they may not be showing symptoms then, it's inevitable down the road that they're gonna have issues, kind of like we saw in the case study. So I knew that my goal long-term was to increase the quality and longevity of patients' life. So that initial exploration and just being around canine pets consistently that were not on heartworm prevention is what led to that goal.
How did the limitations of your method or data influence your new understanding?
So as seen in the first method of research, that data kind of limited me because there weren't a lot of pets. I mean, it showed that all pets were currently on heartworm prevention. And so just seeing like in the day-to-day life of Blue Flint, I know that that's not true. Most dogs are not on heartworm prevention. And I think I discussed with Dr. Hampton, we discussed that maybe the time frame of our analysis is what did it. So like you're in February, people don't think of mosquitoes being out in February. And so I think that's kind of what led to, people not really entertaining the idea of heartworms and heartworm tests. So that kind of limited me to find the understanding that answered my question. So I had to kind of pause and regroup and then implement that second method of research.
And what was the most important research skill you developed as a result, and how you can use that in the future?
I think the most important skill I developed was being more open-minded and flexible. Once I kind of get an idea in my head, I'm kind of gung-ho about it and don't want to give it up. And so I really thought that this analysis would prove what I hypothesized it to prove. And so when it didn't, I kind of like hit a wall and I was like, oh my gosh, what do I do now? And so I had to learn to like regroup and figure out and do something different. So I learned to be more flexible and open-minded and maybe not go into, my next research project so set on one way working. So I think that will be beneficial for like college classes, future research, and even like personal relationships.
All right, you are good.